Well, we have lots of questions that we get asked on a regular basis. Spend a lot of our time talking about sex, which most people are envious about. So, but a lot of our patients are embarrassed to ask. So we decided to go ahead and throw out some questions that we hear or some conversations, so you can hopefully learn.
I would say one of our biggest topics would be libido.
And in pertaining to libido, most women say, well, why is my libido down? Why do I not want to have sex as often as my husband? My husband always says there's something wrong with me, that I don't want to have sex. And I really think that it's important to remember that we are different creatures. Women and men are different. We're built differently. We respond differently. And for us to expect the same results is really unreasonable. And one of the main things to remember is that for women, men, they have a penis, and they will respond according to what that penis wants. I always say, if wind blows funny, they get an erection, they're ready to go. We don't have that. So our sex organ is really between our ears. Our sex organ is in the brain. And if we are happy with ourselves, if we like what we see, we have confidence, exactly, then we're going to really remember that we're sexual beings. And if we don't, it's not going to happen. And so really we need to focus within ourselves, and we need to expect different things of ourselves than men expect. And it's okay. It's all fine.
And I believe with making sex more comfortable, it's about communication with each other as well.
Absolutely. That's a very good point, because again, if one person wants this and the other person wants that, you're going to have problems.
Mm-hmm.
Exactly. So what else do you think that, let's see, we have a little list here. What other things?
We do get complaints about intercourse being
Painful.
Painful.
Absolutely. There are several reasons why sex can be painful. One is, probably the most common one is lubrication. So if a woman is not ready to have intercourse, it's really going to hurt, and excuse me. The other, a lot of people think it's size. Maybe my partner's too big. Well, that can possibly be an issue. But the thing to remember is that the vagina is a very accommodating place. So you need to take it slowly. You need to allow the muscle to relax, and then eventually things will fit. There are instances where I've actually had to use dilators for patients so that they can adjust to a larger size. But eventually it works. The key is to relax and have adequate lubrication. If you continue to have sex, it's important to get checked out. Infections can cause problems as well, so it really is important to have a conversation with your doctor about that. And what else?
What about women complain that they don't have orgasms frequently or not at all?
Well, I think most of the time women talk about not having an orgasm during intercourse itself. I have to tell you that at least 50% of women do not have orgasms during intercourse. They actually have orgasms with more manual stimulation or stimulation in general. And that's okay. It's, again, just the way we're built. The clitoris is what typically gives women an orgasm, and it doesn't necessarily get stimulated during intercourse. And so it is normal. Ladies, do not fret. Do not let your partner make you feel inadequate if you're not having an orgasm during intercourse. He just has to work a little bit harder, that's all.
And communicate a little harder.
Exactly. Women need to be better about stating exactly what they need and what they want. And of course, as we talked about earlier, the size really matter. As we mentioned, sometimes men are too big and that can be painful. I think it's about how much fun you guys are having together during sex. So I think the size is irrelevant. As long as it doesn't hurt, everything is just fine. Exactly. Yeah.
Is there anything else that was a big topic?
In terms of, I don't know, in terms of pain, also, as I talked about, the vagina and the lubrication, but sometimes pain can be coming from the uterus, and why is certain positions more painful than others. If the penis is hitting the cervix, which is hitting the uterus, on deeper penetration, some women can have more pain. And that could be either time of the month, because when women ovulate, we have a little bit of discomfort in the pelvis. It could be position of the uterus with a retroverted uterus. Certain positions are a little bit more painful. It also could be something wrong, so either, again, infection, or fibroids or cysts, those are also possibilities. So again, those are the things that probably should be checked out, and if everything is normal, you just may need to know that you're more sensitive in certain positions than in others.
And if any of that occurs, you can always call and we'll take care of it.
Absolutely, absolutely.